Hi everyone, and welcome back to Dental Tips with Mila. Today I'm going to walk you through how we do dental filling, step by step. If you've been told you need the filling, or if you're just curious about the procedure, today I'm gonna walk you through step by step so you understand what's gonna happen during procedure. Let's get started. The first step is just to diagnosing the cavity. Your dentist will examine your teeth and may take an X-ray to see how deep the decay goes. If the cavity has already reached the dentin, the inner part of your tooth, a filling is usually recommended. This stops decay from getting worse and saves your tooth. Once we know the filling is needed, the next step is to numb in the area. We begin by applying a topical gel to your gums. Then we gently inject a local anesthetic to ensure the procedure is completely painless. You may feel some pressure, but no sharp pain. After area is numb, we carefully remove decay using handpiece, what most people call the drill. We remove just the damaged tissue, preserving as much healthy tooth structure as possible. When decay is removed, we will clean the tooth through. If the cavity is deep, we may add protective liner to shield the tooth nerve. Then we apply a bonding agent to help the filling material adhere strongly to the tooth surface. Next, we place the filling itself. Most fillings today are made from tooth-colored composite material. It's applied in soft layers, and each layer is hardened using special blue curing light. The filling cured, we shape it, matched to your bite. After a procedure, your mouth may remain numb for a couple of hours. And now you know how we do dental fillings, step by step. I hope this video helped to ease any worries and gave you clear understanding of the process. If you find this helpful, please give me a thumbs up and subscribe to Dental Tips with Mila. Share with someone who might need it. Thanks so much for watching, and I'll see you in my next video.